Dr. Restine's advice is intended for veterinary audiences only. Hello, everyone, and welcome to Petworking. I'm Peter Kenseth, Vice President and Partner at Maya Strategy Group, and I am here today with Dr. Lisa Restine. She is the manager of veterinary communications on the feline side of things for Hills. And we are here today to discuss a new report that Hills has just put out, the World of the Cat report. Very timely because, if you've been listening and watching the videos we've done here on Petworking over the last few months, a lot of people have alluded to this being the year of the cat, going all the way back to the eponymous presentation at Pet Connect. And I think a lot of this stems from the fact that people are realizing that there needs to be more cat-specific focused innovation, both in terms of nutrition and in veterinary research. And I won't go on too long here because I want to let Dr. Restine talk a little bit about what prompted and what was the impetus for this report that she was the primary driving force behind. But suffice it to say, there are a lot of examples that we'll get to in the episode about there not being enough cat-specific focused innovation out there right now, both in terms of toys, treats, nutrition, and veterinary care. So without further ado, Dr. Restine, thank you so much for joining us. Thanks for taking the time and welcome to Petworking.
Thanks for having me. I'm really excited. And the more I get to spread the word about cats, the happier I am.
That's great. That is, it needs to happen. I always say I am not a cat dad at the moment. I have Peony, and although if my 6-year-old daughter Isla gets her way, we will have a cat in the house at some point soon. I'm just weighing out at 10 whether Peony can take having a cat added in.
Completely understand how that works.
I've told her we might need to foster if we go that route first and see if they get along. Yes. That it'd be on a trial basis to start. So
I am not a very good foster parent. I fail. I end up not good at giving them up.
Yeah, well, I mean, I think we would probably fail with that too, unless Peony just really didn't like it, or the cat didn't really like Peony. And I've told Isla, with all due respect, Peony came first, so we might have to deviate from the plan if it doesn't go according to schedule. But my brother is a very proud cat parent. I love his cat, Meow Shoe. But I think it is one of those things where we were just talking about before the episode, and I've talked to we've had a lot of cat focused content on Petworking recently. We had Sonia Petkovich with Meowtel. We just had Cecilia Carrera, founder of Bistro Cat. And there's there is this growing acceptance of the fact that, look, there needs to be more focused on cat specific. And I always joke with people when about this year of the cat thing, because I feel like I've heard it's going to be the year of the cat, probably going on 3 years now. And I'm pretty excited to see whether Global Pet this year we do see that cat focused innovation. And we saw a bit of it at WVC, but one of the things I wanted to highlight from your report is in terms of veterinary care, only 40% of cats, according to the report, visit the vet annually. And I was going back to my notes from a presentation from the year of the cat presentation at Pet Connect. And that report said that 60% of cats have actually never been to a veterinarian. So you have the 40% that only make it once a year, and then you have 60% that just aren't going at all. And it's a problem. I mean, we talk about it on the canine side all the time, and I think it definitely holds true. If you're not getting in for those regular checkups, you're gonna miss things that probably could have, the problem could have been far less bad had you gotten in earlier. And I know there's all sorts of challenges, not that I've personally experienced, but every cat owner I talk to, talks about it is such a challenge to bring your cat to the vet. They hate going into a carrier. They're really good at masking pain, so you don't even know if necessarily something's wrong with them unless you're a really attuned parent. But what do you see as some of the strategies to mitigating this problem? Because certainly I don't think people are there, trying to be cat parents so that they can, just lackadaisically have an animal around their house. They love their cats just as much as dog people love their dogs. But um, where's the disconnect, and what do we see as the solutions to this problem?
So I think the solution has to come from multiple aspects of that. And it's all focused around trying to get that cat to the vet with less stress. Because obviously the whole point is not to make this cat's life worse in any way. And, that starts at home. There are things that, pet parents can do, like working with carrier training. So that carrier is a scary box that takes them to places they don't want to go. And, there are things you can do, leaving it out, all the time and working, like, there's a lot of good information available on how to make just even something that less stressful. But then once the cat gets to the vet, if we do kind of get there, it's on the veterinarian to incorporate some of these cat-friendly handling, making their hospital more cat-friendly, and having things available for both the person bringing in the cat as well as the cat themselves to just kind of make that visit efficient and calm and work in the favor of everyone. And so there's a lot of different things you can do. And I think we point out in the report like how many cat-friendly practices there are. Like you can also achieve cat-friendly certification as an individual. You don't have to, it doesn't have to go through just the practice just to get to this training on like all of these different techniques that are available, because what makes a dog happy and what makes a cat happy at the vet are totally different. And it may be counterintuitive, but as a veterinarian, using these techniques will actually help people come back more. They're more willing to do diagnostics, and there's actually an increase in how like your overall business profit over if you're not using these techniques. So it's worth it for all accounts, both for the cat parent, and you. There's no real good reason to not be trying, at least seeing how you can institute some of these in your clinic. So that'll really help. Just making that visit less stressful is huge.
Yeah, I mean, we saw so much of making the visit less stressful at WVC. I feel like that was one of the overarching themes of the conference, whether it was, Chewy getting into veterinary care and, taking a modern animal, but going even beyond modern animal type approach in their clinic design, having couches in the exam rooms, repurposing, the comfort room in their clinics for large dogs that are anxious about going to the vet. Um, you know, but even in those conversations, it was more canine focus. Kong, um, I thought made a really great play and further in their distribution strategy and going beyond just the ecosystem partnership with nutrition manufacturers. That they're putting out veterinary clinic kits now, and they did have them for cats and dogs. But I think ultimately we want to get to this, fear-free collaborative care type of paradigm. It I think it also gets to the fact that like there isn't a lot of, from what I understand, and I was mentioning, I was reading this article the other day about this family who had a cat named Olive, and they were unsure about whether they should take her to the vet. They thought something might be a little off, and shockingly, when they got there, they found the cat was severely anemic. The vet couldn't figure out why. They were, grasping at straws in terms of treatment options, and they were considering removing the cat's spleen when it tragically passed. But the article went on to say that there's not a lot of cat specific education in vet school, and it made the anecdote of the anatomy textbook for most veterinarians is the anatomy of a dog, and you use small dogs as a proxy for your treatment options with cats. And that was kind of shocking to me to hear. I mean, not being a cat owner myself, but I imagine that's got to be not only is it a challenge to take your cat to the vet, and get them in the carrier and, but if you go through all that to get them there and then the requisite knowledge isn't there, I mean, the report says we have 74 million pet cats just in the US alone.
Yeah.
And so, you would think if you could get more, I mean, from the business side of me, that is like just an untapped market just waiting to be explored. If you have 60% of those that have never been to the vet, if you can even get one visit a year out of them, that's, what are we looking at? Like $3,700 a vet visit, 37 times 37 million, we're looking
Yeah.
at like an additional, you know, $370 million in vet fees, right? If we could just get each cat who hasn't been to the vet to go to the vet once.
Yeah.
Um, so
And catching
uh,
diseases early in cats, like when we don't think they're sick, that's really important. We know they don't show signs of disease, just like in Olive's case, until they're so far along, in a lot of times. And even the most attuned pet parent that thinks they know their cat really, really well misses things. Like I did it with my own cat, and that's what I do for a living, and I still did but maybe she's just getting a little older. I'll take her in. I knew enough to take her in, but I didn't think there was anything wrong. And she had a tumor on one of her parathyroid glands, like messing with her calcium levels. So, I had no idea that there was something seriously wrong. She's 16. I thought she had a little arthritis, kind of slowing down. So, without those visits and those checks, you will miss things. Even if you think you know your cat best and you're a cat expert, it's really important to get into the clinic. So, and just getting there and making sure that they're getting, getting the testing that they need in those exams.
and there one thing I thought was great about the report is you highlighted there's a lot of new treatments and diagnostics out there to help you catch things. So if
Yeah.
you can get your cat to the vet, even if they don't necessarily, even if they, I think you were mentioning in your graduating class in vet school, there were like 5 people that were kind of cat focused and
Mhm.
really wanted to specialize in feline medicine, out of 100. So that's like 5%. But, even if you're going to a vet that isn't a cat specialist, if they have these treatments and diagnostics, they're going to catch things. It's not, like they're,
Yep.
um, I think there could be more. It seems like there's ample room to have more specialization, but I think, on the, it's a two-sided problem. If nobody's bringing their cat to the vet, why are you going to specialize in feline medicine? Uh, and if
And I can
you don't feel like there's specialization in feline medicine, is that, disincentivizing cat owners to take their cat to the vet on top of all the other challenges that exist there?
and I mean I can say as someone that's gone through the specialization process, it's increasing. Like we at this actually I got an email yesterday begging for people to mentor because there's such a high interest in becoming feline specialists now. Like we're it's such an increase just in the past few years that we can't even be as available as a mentor, to these veterinarians that do want to seek the specialty. So the interest is growing on the veterinary side too, and we're seeing that through with CE attendance and getting education that's more feline focused. Those events are much higher attended now that I'm seeing. Just being someone in the audience, like knowing that there's so many more people around me at these feline focused talks, like the interest is growing on the veterinary side too, which means the knowledge is growing as well.
Yeah, I mean, and it makes sense, right? Because um, when we did the episode last year looking at the state of shelter pet adoption, cat adoptions are the one thing that's up. Dog adoptions are down. Length of stay for large dogs almost doubled since 2019, and people really seem to be trending more towards small dogs and cats as the pets that they want in their homes. That seems to be the overwhelming trend. We have, the French Bulldog is the most popular dog breed in the U.S. I know the report mentioned the top global cat breeds are the Ragdoll, the Maine Coon, and the Devon Rex. But 31% of cats in the U.S. uh, are adopted from shelters.
Yeah, yeah.
It, kind of amazing. Only 3% are purchased from breeders. Um, but yeah, it doesn't shock me that you're seeing, you know, vets recognizing this gap in the market that exists right now. And like I said, I think it's a two-sided problem. The other side of it is getting cat parents, and I know they said they didn't like that term in the year of the cat talk at Pet Connect, but I'm going to use it. Uh, they said it's more
Hills likes
nuanced.
that term, so it's okay.
Okay. Um, but I mean, so I saw, there's pregabalin oral solution to
Mhm.
help reduce anxiety. So,
Yeah.
what do you see some of these new, available remedies, therapeutics, diagnostics that, may make it easier for you to bring your cat to the vet and hopefully catch things earlier once you get them
I mean, pregabalin is the big one that is on label for cats with anxiety for vet visits. Like that is FDA approved, which is amazing. And that's not FDA approved in dogs for that reason, as far as I know. With that yet, you can use all of these things, but I mean, for the longest time, we were just always using dog medications and extrapolating to cats and saying, well, we think this dose will work, and it's kind of a trial and error because it hasn't been tested. So things like that pregabalin now we're seeing. We're also seeing diabetes is a huge issue in cats. So there are two new like oral agents to help manage. So, if you get your cat in and get them evaluated quickly and you're worried about something like diabetes, these oral agents are great. It's great for people that don't like needles. You don't have to give insulin. They're not for every cat. They're not in for every case, but it's something to talk to the vet about it. And it's really most useful in a newly diabetic cat. So again, getting in early, if you wait too long, then they're not going to be as effective and you might have to use other methods. So, that's a huge one. Not we've only had insulin for many years. So this has been life-changing for many like cat owners and veterinarians. And then as far as like I think to me like the biggest on-label treatment is for FIP, so feline infectious peritonitis that has for most of our careers up until like 2 years ago, it's 100% fatal. There's nothing we can do, and it affects kittens, and it's heartbreaking, and it was just awful. And now we have a drug made that it's like I think 90% successful in treating, and it's FDA approved now, and it's available, and it works, and I've seen it work, and I love it, and like it's just been how many lives can we save from a disease that we can't do anything to like, hey, this is something we can do in 3 months, your cat will be better, and it's just,
and how common is FIP? Is this like where we have 60% of cats that have never been to the vet? I mean, how many people are just seeing their cat pass away and not necessarily knowing why? How easy is it to detect and how common is it?
it's not super common, but it's a pretty small percentage of cats that will actually develop the FIP. It's a virus that almost all cats will be exposed to at some point in their lives, and it just causes mild diarrhea, and it's not usually a huge issue as far as we know right now. Research is still happening with this virus, but in a very small percentage of cases, it'll mutate. And when it does, that's when we see FIP form. Um, I don't know the exact percentage of the population. Diagnostics can be a little difficult. A lot of the tests you run, the baseline tests that you run, are inconclusive, and they just kind of show general signs of things not going well, maybe some anemia or low white blood cells. But it's there are other tests you can do for the virus specifically, but they're not always the most accurate. And since they can still have the virus and not have FIP. Sometimes it can be a little bit difficult to navigate those. And there are really good flow charts and things available to help you on a case by case basis if you're working through that diagnosis. But it's really, really common in cats less than two. So it's really more of a kitten issue, which is, that's when we'll see it most commonly, although it can happen in older cats as well.
Right. Now, is that, I know for, the cats that are getting brought to the vet, a lot of them go as kittens, get their shots and whatnot, and then they don't go back again.
Yes.
Um, is this something, that you can test for, at those initial visits, or is this something that vets need to be saying, hey, up until they're two, you keep bringing them back because, it's a small chance, but this is this use, without treatment, this is 100% fatal if your cat gets it. But we have a therapy for it now. We have a GS 441524.
Yes, yes. Hopefully at some point we'll have an official name for it. It's not something so you can always predict. Sometimes these cats do really well until that mutation occurs, and then things start to change, and the change can be slow or rapid. But sometimes it can be a slower change, and we can see, hey, your kitten's not gaining weight like it should. There might be something going on. Let's investigate this further, or, well, things don't look well, maybe the gums are a little bit pale. So sometimes there are signs, but it can be very easy to say, okay, everything's going well, and then something happens when in that time frame of, okay, we're done with our vaccines, but we're not due for our next annual. So it can be kind of a sneaky disease as well.
Yeah. And I also saw there's, a few new therapies, fibroblast growth factor tests, growth factor 23 tests to detect phosphorus issues for cats with kidney disease, and cystatin B tests for early detection of acute kidney injury.
Yeah.
Obviously, we know kidney issues are a big thing with cats. And, that probably stems to another good point of, dry kibble being the most common thing that people feed their cats. But on the flip side, they don't like to drink water. So, yeah, I feel like I see it at the last few years at Global Pet. The one thing I have really noticed in the cat side is people are really marketing the need to have wet food as part of the diet for the hydration benefits, and cat hydration products are have been a really big thing at Global Pet and Super Zoo the last few years.
Yeah. For all of their strengths, cats are not good at knowing when they need to drink water. And we know how, I mean, chronic kidney disease as they age is one of probably the most common thing in an older cat that we see. I always kind of joke with my clients, if nothing else goes wrong, inevitably it's going to be kidneys. That's kind of the mark that you've made it a good long life with nothing else crazy happening. And we want to help stop that, or at least kind of decrease the amount of cats affected by kidney disease. And these diagnostic tests allow us to track things a little bit differently, a little bit more accurately. They're really good for acute flare-ups of infections in the kidneys, and kind of seeing how things are going. And those acute infections caused scarring and changes leading to this kind of chronic disease years down the line. So these tests are just more tools in our pocket to help us know more about what's going on, and ideally prolong, the quality and quantity of life for these cats.
Makes sense. Makes sense. Yeah. I it's just so interesting to me that, we know so much about cats in some ways, but yet it also seems like we're just scratching the tip of the iceberg. And, um, that article I read the other day, and I know your report notes that, and you talked about more people are focusing on cat specialization. I think the report cited that there's been 46 SAHA accredited cat practices in the U.S. now, and that number is on the rise. You know, um, there's been 12 new feline specific textbooks published in the last few years, more feline specific clinical guidelines. So, I mean, it seems like it's trending in the right direction. It's just, it on the there is also the reality that there is a shortage of veterinarians, right? And we see a lot of people aging out of the profession, and not as many people wanting to go to vet school. And, so although there may be more options and avenues to bridge this gap and add more cat specific innovation and cat specific veterinary education, there may not be the people to fill them as more vets retire or uh, leave the practice due to burnout, and there aren't as many to replace them coming in. I mean, I don't know if the statistics have been updated, but I know the report that Mars did a couple of years ago said that we're going to be looking at a shortage of like 31,000 veterinarians by 2030, which is scary to think about.
And I think one thing we need to realize as a profession is like I was a victim of the burnout too. I mean, I left clinical practice and now I'm here at Hills and I'm still pushing forward cat innovation and trying to focus on it. So you don't have to be on the ground fighting, the day to day. You can still go through everything and use the knowledge and, use yourself to help advocate for, in this case, we'll say cats, but any part of veterinary medicine that you're passionate about. So there's multiple options available, when we think about what we can do with our degrees. And I'm not even going to get into the obstacles of getting the degrees and all of that, but, there's a place you don't just have to be in the clinic, when you're going through that because, we know how important our mental health is and how much we as veterinarians struggle. And, there is a light, you can still feel like you're helping. And the reason why you went to school and do things like write this report and publish all of this data and get to teach others about things, like there's so much you can do. It's just, it might take a little work to find those positions, but they're there, or you can create your own.
It's a great point you make, and I, you know, we've done quite a few episodes, at least a few, not enough, but the issue of veterinary burnout is such a big one for people to talk about and acknowledge. And I tip my cap to anybody in the veterinary profession, and I always say to people who don't necessarily have a good idea of what a day in the life of a vet is, the TED talk that Dr. Melanie Bowden gave a few years ago, that is, just watch that. It's 20 minutes that you know creates such a degree of empathy for anyone who isn't intimately familiar with the behind the scenes working of running a veterinary practice. um, you mentioned, I think most vets go to vet school and want to become a veterinarian because they want to help animals, and they care for animals and they have a passion for animals, whether that be dogs, cats, horses, small, small animals, birds, what have you, or all of the above. But in reality, you are put into a situation where you can't help every animal, even if you could, um, due to financial constraints. You're tasked with the burden of having to run a practice, deal with the finances of that, deal with the personnel management, um, managing, patients and pet parents and handling those relationships. It's, you know, and that's not even getting into the other administrative things of making sure that your practice is appropriately insured, and finding
All of
space, and
Yeah.
or if you're working for a corporate practice, the restrictions on what you can do versus what you can't do, and this is what I would do, but I don't know if I can do this because of company policy and things like that. I you know I you guys do God's work every day, and I think it makes it really cool to see that yeah, if you are getting burnout, like, you don't just need to be confined to staying in the career that was sucking your soul dry
Yeah.
and leaving you in a poor state. I'd love to hear stories of vets that have left day-to-day practice and gone into telehealth, or become a relief vet, and
Yeah.
just finding ways to make those career moves and shifts that let you use the skills and the knowledge that you have while maintaining a sense of balance. So thank you for bringing that up.
Yeah.
um,
No problem. I think it's something all veterinarians are aware of, but I think we still need to talk about it and keep it, at the forefront because if we're already at a shortage and more people are leaving, like the profession isn't going to be sustainable with those trends. So, I think we are trending, I think, better. I think there's with the awareness, but it's nothing. We still have a long way to go before I think we feel that we're, in a good place with everything.
yeah, yeah. No, it makes it it makes a difference. It does. Knowing that there are avenues and options and places to exercise your passions, and people's interests change over time. And
Mhm.
you know,
And it's okay. I mean, it's
and
okay. Like you don't have to be stuck and feel like, well, I know, like if, I wake up tomorrow and be like, I really want to learn equine medicine. My license says I can. And if that's something I'm passionate about, it's something I can at least attempt to do and decide, we have that availability. I think we kind of lose sight of that. We get kind of shoehorned into, well, I only know how to do emergency medicine, or, I only know how to do my, high quality like spay neuter. And I kind of don't remember everything. I went like 10 years in a feline only clinic and then I was a hospitalist at an ER for dog and cat. And I was like, I have not treated a dog in 10 years. And now I'm treating the critical cases. You learn it, you relearn it. It's all there, like it was hard and I asked a lot of questions and I relied heavily on my technicians and nurses, especially in the beginning, but I really enjoyed it and I relearned a lot of things and I think it, made me a better veterinarian overall just because of that, experience.
yeah, and now going forward, with all these, new cat specific textbooks, guidelines, things like that, there may be more opportunity. I know you were saying, before we started recording today that, of the five that were, cat focused in your class and really wanted to specialize in feline medicine, um, it was tough to find, to seek out the resources and the literature. And I know you're saying now, that there may be a challenge of find available mentors, for feline specific medicine, but at least there are more textbook resources and a chance for people to focus in on that passion and that specialization. And you know maybe that's what it takes to bring more veterinarians into the profession, is understanding that you can specialize in feline medicine, you can specialize in equine medicine, you can specialize in canine medicine. Um, you know, uh,
Actually, there is no
uh,
canine only. It's canine feline. So the cats are special with the small animal. In the at least in North America, the specialization I have with the American Board of Veterinary Practitioners, it's canine feline or feline, but you can't do just canine at this point. So the cats are special.
really
Hmm.
interesting. I learned
There's a
something
ton of
today.
other species, and I'm just talking small animal, but that's where it is right now.
Interesting. Interesting. And do you feel like that's the case so many because the focus has been so predominantly canine historically, that canine feline just sort of groups it all in, and then they broke feline out specifically because it was so underserved?
Yes, I think that's part of it. And I also, there is really no, as far as I know, like there may be some small ones, but there's not like a canine only clinic. Like most clinics will see dogs or cats, but there's a multitude of and growing number of feline only clinics. So it's, that's why I think there's just a need of the specification or the specialization because we have that like niche in veterinary medicine, which is it's continuing to grow. So that's at least with the species specialty. And this may be different globally, of course, because I can only really speak for the North America off the top of my head, but for the canine part, because I don't know what goes on in the dog world.
Yeah. Interesting. Yeah, one thing, and obviously we probably won't get too much into it given your North American focus, and I certainly don't know too much about Russia, but I found it interesting that Russia has the highest percentage of cat owners. That 59% of households in Russia have a cat. And that grabbed me. But within the U.S., I think we're seeing a lot of growth in cat ownership. Like we said, it's the one that and small dogs are the one area where adoption rates and length of stay is shortening on the adoption side. And we're also seeing people who have not been cat owners. I think they were saying at Pet Connect, 35% of cat owners have little to no prior cat experience, and 19% are first time cat owners. So, that speaks to growth.
Yeah.
It's not just, what we're seeing in terms of shelter pet adoptions. It, you have 19% of your population that hasn't owned a cat before. That's that's on the upswing. And, that we're
Absolutely.
seeing now cats have a higher rate of pet insurance policies than dogs. Um, to me, that should theoretically mean that more people are taking their cats to the vet, but that's a disconnect for me because if we have, 60% of cats that have never been to a vet, but now we have more pet insurance, it's got to be like for catastrophic, or people are just like,
Yeah.
it's cheap enough that they have it, but don't
And I
feel
think
like
there's
they
a
need to use it.
misconception. My cat doesn't go outside, so it doesn't need vaccines, so it doesn't need to go in every year. So there's just that whole thought process, which the vaccines are just a small part of what we like. They're important, of course, and I don't want to discount their importance, but the important part is the exam and, talking to the veterinarian because it's our job to be able to listen to what you say, get a full history, look at your cat, and be able to try to help you pick up on these early warning signs and educate and prepare you for things to look for. So the exam is the big part of it. The vaccines are kind of a bonus and they're really good for protection, but it's about getting into the clinic and getting someone outside of your house's hands on that cat to look at them and then lean into their knowledge.
Yeah. Yeah. I mean, urinary tract disease, GI issues, catching the kidney issues early.
Dental
I
issues,
think,
like obesity is a
I think,
huge one.
yes, no, your report said 61% are obese and
Yes.
only 28% of owners recognize it. So that means we've got, you know, sizable
Yes.
portion, if only 28% of the 61% who are obese are recognizing it, there's a lot of obese cats out there
Yeah, and
that,
and you can't just throw your cat on a diet and cut their food. You have to do it the right way. You don't want them to lose weight too quickly. You don't want to just a normal, food that's for indoor health or whatever, if you just start cutting back on how much you're giving, it's balanced for that cat to eat a certain amount. So if you just restrict it, they can be restricting other nutrients. So, weight loss diets are key. Talking to your veterinarian about how to use them and how to actually, how much to give and have them do those calculations. It's really, really important to make sure that you catch obesity early so they don't get super overweight and, predispose them to things like diabetes and joint issues. And, if they are obese, work with that diet plan in a safe way, so you're not causing any other problems.
yeah, yeah. No, I mean, I think it's, what, from my perspective, it's like, what do we see as like the primary driver of obesity in cats in the first place? I mean, is there, an opportunity for better education to make sure people are feeding the right way, that they're not over treating, that they're, you know, um, we're seeing more and more cats just being indoor cats, but
Mm.
how do we make sure they get enough exercise if they're just inside? What are any of those, do you think, more prevalent factors in obesity than others? Or
I think it's a lot to do with just our perceptions of what cats, how much they need to eat is a big one. We, they're so just they're small and they don't need a lot of food. They don't need a lot of calories, but feeding them, I mean, as a cat owner myself, like it's a love. That is how I show love to some. We give treats because we love them and they're so cute and we can, teach them to do things and they're happy when they get fed. So there's definitely a joy of that pet parent feeding the cat and you want to do that more. But cats also love to beg and they don't understand that they shouldn't eat all day long. And they are sedentary creatures. They sleep 18 to 20 hours a day. So, when even if they are very active, if you're eating so many calories and you're really active, you'll build muscle under that fat, but you're not going to lose weight. So you have to keep in mind it's about how much we feed, and every treat is a calorie, every table scrap they get is calories. And, if they're grazing all day long and we're not restricting their food, it's hard. And I think we've gotten so comfortable with what a fat cat looks like that when we see a normal thin cat, we're like, oh, that cat's too skinny. And that's not, so there's just that perception because we're so used to seeing cats that are overweight or obese. And we've almost
yeah,
normalized it in a way.
yeah, it's a problem on the dog side too. I definitely spoke to a lot of folks at WVC of, you know, mm, we might, instead of having, the 5 to 6 on the acceptable scale, we might want to be aiming more towards a 4. Uh, and um, yeah, it definitely, I get it. I mean, I there's nothing more exciting to me than seeing Peony jump up because I've got a salmon skin for her, or when you can create that excitement, that is,
It feels good.
that's a bonding.
Yeah.
I don't care whether it's from a treat or if we're out skiing and she sees in the open stretch of trail that she loves and kicks it into high gear. You want those moments where you have that shared joy and excitement with your pet, whether it's a dog or a cat, but it does contribute to um, this pet obesity epidemic. And yeah, and
And there are ways to work around it and still have those moments and be cautious about what you're feeding, but it's going to be very individualized for each cat and dog. One thing that I find is really helpful is actually we would use our body condition score, but it's a body fat index chart, and we have I know it's available through like the Hills website, but it's a nice, really visual, and it was so helpful to have like this is good, this is this is a warning stage, and it talks about like percentage of body fat, cats and dogs, and it was an easy chart. I used it in the exam room all the time, so I definitely recommend, if you don't have that as a resource, it was a really good visual aid for pet parents to understand like what this means for like why this is a problem because they're like, but they're cute. It's just more to love and say, well, actually, these are the this is what's going on. So definitely recommend utilizing tools like
and
that.
when you're estimating body fat percentage, is that like coming from a specialized scale, or is that just I'm looking at the pet's weight versus what I think they should be given their size, and this is an,
So
an estimate of their percentage body fat?
they there's a nice little chart that goes with everything, so you don't even have to do any of the math because there is like some math behind it, but we have a chart for the cats and the dogs that you can use and just reference where they fall in there, so it's like no extra work or time on the veterinarians, and so it's I'm all about being efficient because we don't have enough time in the exam room as it is. So like anything I can do that will save time and help me do things like, cover obesity, which is already a hard thing, a hard discussion to have. Like this was a really helpful tool. I
Yeah. Do you, One thing that got me, pretty excited um, at Pet Connect was the kind of emergence of wearables on the cat side. Like, I don't know if you've heard of Mogi or um, they have the collar, and then theoretically it's telling it will let you talk to your cat. I Okay, I'll buy into it, but I at least buy into it from the perspective of, okay, if this is taking biometric data and cross-referencing it against acceptable levels, like it's going to give you clues about, hey, you might need to get your cat seen. And I think I've had Peony on a wearable that tracks her respiratory rate, heart rate, and heart signature for uh, almost a couple. It's probably a year and a half now, but it's like it's really helpful and comforting to me that I can look and be like, okay, your heart rate is, it's staying at that level that, where it's at. This is your baseline. And if I see it jump above or below that, it's helpful. And, you know, Cecilia Carrera with Bistro Cat was saying the other day, that it's an automated wet cat feeder, but it's also giving you information as to, how quickly is your cat eating? Did they eat all their food? Um, and it is flagging signs. They're going to have an accompanying smart scale that comes out with it next year. So I think there will be things that hopefully help reinforce this need to get your cat to the vet and help to kind of dispel that uncertainty around, oh, I think my cat is fine. That there will be that third party um saying, no, you may want to go and get this checked out. And so
Yeah.
hopefully that increases the prevalence of vet visits that we see going
Yeah,
forward.
that I know there's some things that are in development and that are already available. And the more data we have, usually the better. Sometimes it can be a little bit too much, it can be a little like, oh my gosh, do I need to worry, but I think I would always rather have that information available. I think anything that's going to help get these cats to get seen more.
Yeah. Well, I mean, and especially, because they're so good at masking pain. And if they are, so for cat parents, it seems like even as the parent may not notice it and
Absolutely.
um, but then if they're anxious in the exam room too, if you have this wealth of data that you can share with your veterinarian, like that is taken in real time outside the clinic, I mean, to me, like that is so helpful because I mean, Peony gets very anxious when she goes to the vet. I don't blame her. I'm hoping, with this move towards making, more aesthetic and comfortable clinics, we get a room with a couch at my vet. But right now it's a 8 by 8 white tile floor room, and she's nervous, and it's like, I give all the props to my vet because she'll come in and sit on the floor with her and watch her and work with her. But having that data from outside to be able to say, like, yeah, I know what her heart rate is normally. I know what her respiratory rate is normally.
Mhm.
Um, because they're probably not going to get a good reading of that in there while she's panting and looking around.
Especially with the cat.
So
Yeah.
yeah, I think it definitely hopefully brighter and better days ahead as tech drives more people to the vet and hopefully get some of these 60% of cats that have never been to the vet into the vet for the first time. So
Yes, I think
yeah,
I think that's kind of everyone's goal, like it's just it can be it's a hard goal, but that's why this things like this report exist is to help draw attention to all these statistics, bring awareness to what's going on, trends, changes, just listing it all out there in one place so that, people can look at it and say, "Oh, I didn't realize that, maybe I need to really focus on getting my cat patients in more often. I wasn't thinking about it, because veterinarians have 1,000 other things on their mind." So like my goal is to help just drive awareness and bring attention to all of the good changes that are happening, what needs to continue to happen, all just kind of in general.
yeah. Well, I mean, I think that there's so many good learnings, and I tried to touch on as many of them as we could today. But I would encourage people if you're interested, go and check out the report. Um, it is available on the Hills website, the 2025 Hills Pet Nutrition World of the Cat report, and have it on hand as a resource, whether you're a cat parent or a vet looking to increase your feline medicine resources. There's a lot in there. I mean, um,
I know we talked about
I personally,
E2,
I per
like, yeah, go ahead, sorry.
no, I didn't mean. I was just going to say, the pregabalin thing. That's amazing to me. I wish there was a on-label uh, medicine for dogs for reducing anxiety for veterinary visits. But the fact that like that is FDA approved for that, like that's
Yeah,
huge. And
yeah.
I don't know how many vets or cat parents out there necessarily know about it.
Yeah, I mean, I know about it and I hope everyone does, but this is why I want to make sure we share.
Absolutely.
It's hard to keep up with
Absolutely.
all the new innovations that are happening.
Yeah, and you were going to say you were saying something
Oh,
about
we were
BT?
talking about like CE and feline specific CE. So I was going to say like Hills has Hills Vet Academy, which has a bunch of CE on there, and a lot of it is feline specific as well. So like, if you're looking for feline content, like that is another really good resource that is available and it's free. So that's always a good thing.
Definitely. I hope the vets out there who are listening, take a moment to go and check it out because it's a very rich report. You guys did a great job, and I'm hoping this is a great accompaniment to the what hopefully ends up being the year of the cat. Not to disparage the dog parents out there, and but we've had innovation on our side for a long time, and I think it's probably time for cats to play catch up a little bit,
Yeah.
both in terms of nutrition innovation and veterinary specific education and feline focused medicine. So
And my goal will be to update this, periodically. I'm not sure how frequently it'll need to be, but maybe with different focuses each time, with just stronger things there. This is very new and, obviously this is the first time we've done it, but I want to continue to provide stuff like this so that way, we have these resources available.
Yeah, no, I think it's so cool that you guys do this because I think it having a name like Hills behind this definitely lends credence and credibility to it. But it's something that every cat parent out there or veterinary professional or pet care professional can take you know
Yeah.
good insights away from and really lead to the betterment and quality of life for all animals. And
Yeah.
in the
I mean,
same way that the state Aiders of Shelter Pet Adoption report, does so much to call out what's going on in the adoption community, and that's a great resource for everyone.
yeah,
You know.
I was really excited, and I can't say I can take credit alone for this. Like we created a cat advisory team with Hills, which were just feline specialists, nutrition behaviorists from all around the world, and like they helped me, review all of the content, make sure I was focusing on everything well. So like we had a lot of really, really brilliant people and smart eyes on this. So it wasn't, this was a huge collaborative effort with everything. So I'm just really excited that, people are reading it and to get the information out there and to work with such a wonderful group of people with Hills and outside of Hills as well.
Yeah. How long did it take you to put together?
Uh, Maybe 6 months of just kind of data
Wow.
gathering, figuring out what I wanted to say, going through the review processes multiple times. So now that I have a good baseline, I think it won't be quite as big of an undertaking, but I finished it. I looked yesterday. It was officially sent for, to make it look all nice and formatting on December 26th. And I had started in around June. So it was about 6 months.
Wow. A very truly a great, truly comprehensive, involved effort. And thank you so much for taking the time, and thanks to all your collaborators and everyone who worked on it. And hopefully we can check in again for the 2026 version of the report and see what's changed and if this was in fact the year of the cat.
Well, I
Well,
mean, hopefully we'll
well,
continue to stoke the decade of the cat, right?
that's right. I don't want to leave our dog friends out in the lurch, but if we can catch cat up to where dog is and they can continue driving forward together, I think that's the goal. We want to
I
make
think
things
that would
better
be,
for everyone, people and their pets. So
yeah, yeah, that is what every veterinarian and every pet parent wants.
exactly. Well, Dr. Steen, this was great. I really enjoyed the conversation. I learned a lot. Hopefully, our listeners did too, whether you're a cat parent or a vet. There's, like I said, tons of good content in here. And while we tried to cover as much of it as we could today, I'm sure there are some nuggets in the report that you can go through and pull out. And if you find them, let us know in the comments, and they'll be there for everybody else's benefit as well. So. Thank you
Thank
so
you.
much for taking the time.
Thank you so much for having me. I had a great time.
Glad that's always my goal. I want my better for people and pets, and I want my guests to be happy when they leave. So, thank you, Dr. Restine.
Thanks.
And this is Peter Kenseth with Petworking. We will talk to you all again soon. Take care.